Hello, my fellow future and curious little rats out there. Welcome to the Lab Rat channel. My name is Squee. This week I decided to talk about urinalysis and what all we do in order to get your provider those results. So most of the time when your physician wants a urine specimen is because of lower abdominal pains, which could be caused from kidney stones, urinary tract infection, kidney infection, STIs of different kinds like gonorrhea, chlamydia, trichomonas, a few other out there. But the biggest thing is there's two different types. There's clean catch and there's dirty catch. Clean catch is what your provider is going to need when they are checking for urinary tract infection, kidney infection, or stones. The one thing that most people don't do, refuse to do for whatever reason when collecting a clean catch specimen is it's called a clean catch for a reason. That reason is these. These are cleaning wipes. You will always be given cleaning wipes and directions on how to properly use them if directions are not properly posted in the bathroom at the facility. And you really need to use these when you're doing a clean catch specimen, because in the lab, one of the things we do is we look at the urine under a microscope. And we report everything in there that we see. So epithelial cells, mucus, bacteria, yes, we report sperm. All these things get reported. And if the provider sees that there's a lot of epithelial cells in there, they're gonna know that you didn't properly clean, and it's going to really be a no good specimen. They will most likely be calling you back in to recollect because you did not get an appropriate specimen. The only time you don't use those wipes is for the dirty catch, and that is when we are looking for the STIs. Those are the only times you won't be using them unless it's a chemistry that we're having to run for patients that are undergoing kidney transplants. There is what's called a creatinine clearance. There's a few other different urine related tests for like uric acid and stuff like that, but most of the time for a creatinine clearance for the kidney transplants is they will send you home with a 24-hour urine container. And of course you don't clean every single time with the wipes. That's not to be expected. That's a little on the ludicrous side when physicians require some of their patients to do that, and I have seen it. But that's a different thing. We're just going over basic urinalysis today. The other thing that a lot of times causes for a reject specimen is the container that is used. Containers that look like this are the only types of containers that are acceptable and suitable for urine specimens unless you are given a 24-hour urine container or something else. Do not bring your urines in mason jars, soda bottles, tea bottles, butter containers, leftover containers, Ziploc bags. Yes, I've seen all of those come through the lab for clean catch urine specimens. They're rejected on the spot because those are not sterile containers. I've worked at a few facilities that have had their patients give a sample in the little paper, little Dixie cups, like what you use to wash your mouth out at your dentist office. not acceptable. They're not sterile. We need a sterile container in order to get accurate results. We kind of have a thing in the lab of garbage in, garbage out. You give us a junky specimen and tell us to run it. Well, read the results at your own risk. And we do put comments in there if the physician tells us to run it anyways, to let them know that the nurse was informed of improper collection, patient was informed of improper collection, whoever was informed of improper collection. We did ask for a recollect and we were refused and denied. And so yes, we will leave a comment in there of who we talked to, when we talked to them, and to let the provider know to read the results at their own leisure, whether they want to go by those results or if they want to tell the patient to recollect. The other thing with specimen collection for urines is we do not want, nor will we run urine that has been wrung out of a diaper, whether it's a baby's diaper or a adult's diaper. It doesn't matter, because of the fibers and everything that are in diapers or incontinent pads, whatever you want to call them. Those fibers get in the way. They give us bad results. Some of the fibers show up looking like uric acid, even though the patient doesn't have uric acid, but we end up reporting it out as possible uric acid. And then the next thing you know is your patient is on medication for uric acid, which, if you don't know what that is, it's one of the main causes of gout. So yeah, no diapers. For babies and pediatrics, we have a special bag that has a foam sticky ring around it with a small hole. And with the babies, nurses will put it on them and then put their diaper back on them. They'll wait a few hours and then use whatever's been collected in the bag. Something else that nurses can do or doctors can do if the patient cannot go to the bathroom is a catheter, which catheters are yet a different type of container. There's two different types of containers for catheters. There's a long cylinder that's got a white cap that the catheter tip, tubing can go into, and they can fill that up. Or there is a half size taller bottle. It's like half the diameter. That also has a white cap that when we see those come in, we know it came from a catheter specimen. And that is just from somebody who's already got a cath bag hooked up or whatever the case may be. That's the nurses letting us know this specimen came from a catheter collection of some sort, so that way we can put it in like that. And again, because we know it came from a catheter, there's a few things in there that we're looking for that will not show up on a normal specimen collection. So yeah, no little Dixie cups, no red Solo cups, no mason jars. As I said, none of that. If you're doing an at-home collection, in your physician's office collection, one of these, use your wipes. Get us that clean catch. Otherwise, we will be rejecting the specimen. You will have to do it again. Aside from that, it's pretty simple. We always give directions to the patients when they come to us directly. We explain everything to them, why we need it done that way. One of the crazy things that I saw come in a couple weeks ago at the current lab that I'm at, as you can see, my background has changed. I'm a traveling lab technician. So I go from state to state, city to city for 13 weeks at a time. If I really like the facility, I stay longer if they need me to. When I'm done with my assignments, I'll put together a overall cumulative video that shows everything I did in the area, but I won't do it when I'm on my assignment because people really don't need to know where I'm at, what state I'm in until I'm done with it. But no, one of the things that I had come in a couple weeks ago at my current facility, they didn't want to catheter or straight cath, which is just a quick in, get the urine, pull the tubing out, it's done. There's fully cath, where they put it in, there's a little balloon on the tip of it. Once they get it where it needs to be, that they fill with saline solution or deionized water, whatever the facility wants to use. Foley's are normally the ones that they use when you go in for surgery, or if you're bedridden. OB patients end up with Foley catheters if they've had a epidural because they're not allowed to get up out of bed. Those are the ones that are meant to stay long term. Straight cath, just in, out, couple minutes, done. But this specimen that I got, they couldn't get urine out of this lady, and so the ER nurses ended up taking cotton balls and packed them in there and sent her to the floor because she was going to be staying there for a while. And they told the nurse that received her on the med-surg side what they'd done. And as soon as she saw that these cotton balls were completely saturated with urine, she put them in one of these cups thinking that was acceptable and sent it to the lab. I was the one that received that one. I get this cup in and I'm looking at it like, are those gallstones? What are those? I opened up the cup and reached in. Yes, we play with things as long as we're wearing gloves. And discovered that it was a cotton ball. 2 of them. One of them completely covered in iodine. Again, not acceptable. Come on, nurses. You were taught better. Do better. So I ended up calling to the med-surg and I explained to the nurse that I was rejecting the specimen, explained why I was rejecting the specimen, and told her we needed to recollect. I never did see a recollection specimen, and where I'm at, we write this stuff on a board so next shift can see it, or the shift after, whatever. Whiteboards are the communication method where I'm at. Nobody ever saw recollect on her, so maybe the physician really didn't want it. We don't know. But yeah, cotton balls shoved up. Wrong. Just wrong on so many levels. As I said, nurses, you know better. You were taught better. Do better. And yes, I can say you were taught better because at least with the nursing program that I went to before I decided to become a lab tech, we were taught better. And that was at a small community college. So if a small community college is teaching better, I know the bigger colleges and universities are teaching better. So yes, clean catch, these only. These cups come with white lids, orange lids, blue lids, clear lids. Not all of them have this orange lid, but sterile specimen container for a clean catch. Nothing else. So may you all have a wonderful week because you choose to have a wonderful week. And I'm enjoying where I'm at right now. I will see you all next week. Bye-bye.